Ready.
Good afternoon. Good afternoon. My name is Lisandra. We are presenting the final project on the patient satisfaction in healthcare solutions and remarks to avoid the issue on low patient satisfaction. Our group, we have me, Lisandra Jude, Helen Lam, and Angelo Fleurimont. In a patient-centered healthcare system, collaboration and responsibility of plan of care is shared between patients, family members, and healthcare providers. Its goal is to improve every person's health outcomes. Therefore, measurement of patient satisfaction is a factor that must be taken into account for the success of each healthcare facility. In addition to the quality of care, patient satisfaction includes the patient's perspective of receiving good care. It's a method to measure healthcare quality, effectiveness of the care, and the level of empathy. Our project reflects evidence-based variables that impact patient satisfactions, like patient and family members' expectations, timely healthcare services, cost and access of healthcare services, and we are going to talk about strategies that can be applied to enhance patient satisfaction. The first case that we want to take in attention is was studied by Belio Bucalerio in 2021. They hypothesized that the impact on the quality perceived by patients is reflected in healthcare providers' performance in three areas: physical environment, empowerment, and dignity, and patient-doctor relationship. So the physical environment is related to the atmosphere, the cleanliness and color, food quality of the facility. The empowerment and dignity is referred to how the patients are treated, if they're treated with respect, and they are given a role in their own healthcare choices. And for last but not least is the patient-doctor relationship, which is the measurement of empathy, capability, professionalism, and communication between patients and physicians. Okay, the patient satisfaction by seen through the family members' perspective was studied by Seminov Tal in 2021. They did a case on Israel using the geriatric hospitals and nursing homes. So they did a telephone-based survey on satisfaction of care in geriatric institutions delivered to family members of patients. Out of the group, just 2.3% expressed concerns on physical safety, verbal violence, discrimination, lack of dignity and respect, physical conditions, and lack of communication. The greatest impact out of this concern was on verbal violence. The family have a direct impact on patient satisfaction with an average low score of 5.15. This results with the fact that verbal violence is seen as an intentional and is attributed to misbehavior of the staff. The family unsettled behavior focused on identify, care, and the treatment of the elderly with humiliation and abuse.
When it comes to patient satisfactions, unfortunately, there are a lot of obstacles that are being faced with satisfying your patient. One is the wait time. Patients who arrive at the hospital through the ED to the emergency room will often experience long wait times of between 3 to 4 hours on average. And working in the emergency room, that's something that I'm very familiar with. When a patient comes to the emergency room and they're not seen by the doctor until an hour later due to the amount of patients that are in the emergency room. Next is the long wait due to non-emergent emergencies. Example, we have some patients that come into the emergency room with things like a sore throat, or their toe hurt, or their fingers hurt. Things like that will stop and will cause a longer wait for the patient who actually have an emergency. An example, a patient might come into the ER because they having a chest pain, And because 3 patients ahead of them came in and they're here because of their toe hurt, they have a sore throat, they have a headache, things like that will slow down the process of the patient being seen. Lastly, when hospitals runs out of bed, it makes it very difficult to treat patients. An example could be in regards to COVID-19, where a lot of hospitals were running out of room to see patients, where patients will have to be seen outside or in the waiting room due to the fact that the hospital is at full capacity. The next obstacle is cost of service. Per capita, healthcare spending exceed over $10,000 in the United States. That is 2 times higher than Australia, France, Canada, New Zealand, and the UK. And the cost for private spending is 5 times higher than Canada, which is the second highest spender at $4,092. And on average, US citizens and US residents pay about $1,122 out of pocket for healthcare, which include co-payments for doctor's visits, prescription drugs, and for healthcare insurance deductibles. And I come across things like that very often in the ER, where a patient will come into the ER because they're removing their sutures and they stay in the ER for 10 minutes and they have a co-payment of $1,000. And things like that will usually scare patients from coming to the ER due to the cost of care.
To address the emergency relief or long wait times was started the case by Lavery Deal in 2019, where Dr. John Nelson, Vice President of the First National Healthcare, a large publicly traded healthcare provider, decided to advertise current waiting times in billboards in busy highways, hospitals' websites, and even though of creating an app that allows patients to check waiting times on their phone. As a result, average waiting time in the FNH ED significantly dropped from 54 minutes to 37 minutes, and the customer satisfaction increased. For cost of services, the healthcare have to face different challenges, basically because the Affordable Care Act and the Center for Medicare Services, the CMS, changed from pay for services render model to a pay for performance model. This case was a study by Osmel Delgado, the Chief Operating Officer of Cleveland Clinic, Florida. They face serious economic challenges in terms of the new reimbursement policies. Their solution was to increase staff responsiveness. So nurses, physicians, and every caregiver needed to communicate with the patient all the time. And using smart technology in each patient's room, physicians can have a real-time information to every patient's questions or concern. So at the end, if we compare the patient satisfaction scores compared to the national average, they came across with the same benchmark. So that way they won't be affected by the reimbursements of the Medicare and the HCA.
Okay, to help to get information about patient satisfaction, the operation-oriented strategies is part of a solution. Morky and colleagues did the investigation about patient satisfaction. They took 210 healthcare consumers in Ghana, and their hypothesis was professionalism in service recovery had an effect on patient services. They used a structural equation model to get information. So once they did this finding, service recovery was most for patient satisfaction. Within this, mindfulness was some of the factors that can affect patient satisfaction. Mindfulness focuses on cognitive abilities to make decisions on different solutions. As professionals, we have to give the proper care to a patient. When it comes down to service recovery, if there's a problem, how we're going to resolve the solution, or saying a simple sorry to the patient will make them feel at least comfortable with working with the profession. And also, as a patient-centric approach, it's important to make your patient feel valued, you have empathy, and having communication skills with your patients. As for the model that Boyke and colleagues did, as this structural model, it says that service recovery was 0.45 to patient satisfaction. As for professionalism, it was only 0.10. But the service experience overall was 51.2%, and patient satisfaction was 61.6%. Also, focusing on lean management, which is basically cutting down waste. Just like how Angela was talking about long wait time, if we can try to eliminate wait time, patients will be happy. The staff should be friendly and be very helpful to affect patient satisfaction. As a healthcare worker, focus on these skills can help improve patient satisfaction. And also, of course, as healthcare organizations, we also have to have a patient-centered approach.
In conclusion, if there are any problems, a simple "I'm sorry for the inconvenience, but we are working on a better solution" goes a long way. We're all saying that an apology goes a long way means it's effective and yields a positive result. When a company apologizes for selling a defective product or failing to live up to the promised service, it may usually win back customers and patients' trust. Recovery services is another strategy that can help improve patient satisfaction. And when a healthcare organization adopts strategies that are operation oriented, they strengthen and improve the quality of healthcare delivery. With that said, this has been our presentation. Thank you very much for tuning in. I hope you guys have a great rest of your semester. Thank you.
Thank you.
Thank you so much.